Hello. I want to start today with something very simple, something you can do right now, if you are willing. Make a fist with your dominant hand. Squeeze it as firmly as you comfortably can. Hold it, and then release. That squeeze, that simple measurement of how hard your hand can grip, turns out to be one of the most studied and most informative single measurements in all of geriatric medicine. Researchers have been studying grip strength for decades in populations across the world, involving millions of participants. And what they have found, again and again, is that this simple measurement predicts far more about a person's health than most people would ever expect. My name is Dr. Chen. I am a physician in internal medicine, and today I want to explain, in honest and specific language, why grip strength matters so much after 65, what it tells us, and what the evidence says about maintaining it. This is not about opening jars more easily, though that matters too. This is about something much larger, about what grip strength represents as a window into overall health, and what the research shows we can do about it. Let us begin. Now, first, I want to explain what grip strength actually measures. Because the reason it predicts so much is that it is not really just measuring your hand. Grip strength is a measure of overall muscular strength, because the hand and forearm muscles are representative of the broader muscle system. When grip strength declines, it almost always reflects a broader decline in muscle mass and function throughout the body, what researchers call sarcopenia, which I discussed in detail in the previous video. In that sense, grip strength functions as a proxy measure, a simple, inexpensive, reproducible measurement that reflects the health of the entire musculoskeletal system. And because the musculoskeletal system is deeply interconnected with cardiovascular health, metabolic health, neurological health, and overall physical reserve, grip strength ends up predicting outcomes. That seemed far removed from the hand. Let me tell you what the research actually shows. And I want to be specific because I think specificity is more convincing than generality. The first outcome is all-cause mortality. Grip strength is a predictor of numerous future outcomes. Mortality is probably the most widely studied outcome, with studies published as far back as the 1980s and at least 3 meta-analyses supporting the association of weak grip strength with all-cause mortality in the general population. One meta-analysis of 22 studies found a pooled hazard ratio for mortality of 1.79 for low grip strength. Another meta-analysis of 40 studies found a hazard ratio of 1.16 per 5 kilogram reduction in grip strength. A third meta-analysis of 33 studies determined a reduced risk of mortality for higher versus lower grip strength, with a hazard ratio of 0.69. Now, I want to be careful about how I present this because association does not mean causation. Low grip strength does not cause death. What it does is signal something important about overall physical reserve and overall health status. That is associated with future outcomes, including mortality. The Lancet published findings from the large PURE study, one of the most widely cited studies in this area, which found that grip strength was a stronger predictor of all-cause and cardiovascular mortality than systolic blood pressure. That comparison to blood pressure is striking. Blood pressure monitoring is standard in almost every medical visit. Grip strength measurement is not. Yet in that large study population, grip strength predicted these outcomes more strongly. The second outcome is hospitalization. A 2025 study using data from the National Health and Aging Trends Study involving community-dwelling adults aged 66 and older found that grip strength was a significant predictor of 1-year hospitalization risk and 3-year mortality in older adults with multiple chronic conditions. Gait speed and grip strength are widely used measures of physical function in older adults and are predictive of disability, hospitalization, and mortality. The third outcome is disability and loss of independence. A large body of evidence suggests that a decline in hand grip strength is significantly associated with frailty, functional limitation, cardiovascular diseases, and all-cause mortality risk, making it an essential part of geriatric assessments. Now, functional limitation is the term researchers use for difficulty with the activities of daily life: dressing, bathing, cooking, getting in and out of chairs. These are the tasks that determine whether a person can live independently. And grip strength, as a proxy for overall muscular health, is a meaningful predictor of whether those limitations develop. The fourth outcome, which may surprise you, is cognitive health. Studies have highlighted the association between hand grip strength and executive functioning, indicating its potential role in cognitive impairment in older adults. Furthermore, hand grip strength has been linked to learning, verbal fluency, and a reduced risk of cognitive impairments such as dementia. Now, I want to be careful here. This is an association, not a proven causal pathway. What this likely reflects is that the same factors that maintain physical health, physical activity, adequate nutrition, cardiovascular health, also maintain brain health. So grip strength is not protecting the brain directly. It is signaling overall health maintenance that benefits both the body and the brain. The fifth outcome is falls, which I have discussed extensively in previous videos. Grip strength, as a reflection of overall muscular strength, is directly relevant to fall risk because fall prevention, in the moment of a stumble, depends on the ability of the muscles throughout the body to respond quickly, and grip strength reflects that overall muscular capacity. Now, I also want to mention something interesting about trajectory, not just level. A study following very old adults over nearly 10 years found that men and women with a declining grip strength had a 16 and 33% increased risk of mortality, respectively, for every kilogram per year decline. And participants with an improving grip strength had a 31% decreased risk of mortality, regardless of their starting level. That last finding is particularly important, regardless of baseline level, meaning even people who started with lower grip strength showed reduced mortality risk if their grip strength was improving. This suggests that direction of change matters, not just where you are starting from. And it points toward the value of actively working to maintain or improve strength, even when you are starting from a lower baseline. Now, I want to address something practical, because I think many viewers will be wondering, can grip strength actually be improved in older adults? And if so, how? The answer to the first question is yes, with an important qualification. Muscle strength at all ages is highly adaptive to resistance training. This is consistent with everything I described in the muscle loss video. Resistance training, progressive, consistent, appropriate to your starting level, produces meaningful improvements in muscle strength, including grip strength in older adults, including those in their 70s, 80s, and beyond. Now, what does resistance training for grip strength actually involve? There are two components worth distinguishing. The first is general whole body resistance training, which I described in detail in the muscle loss video, because grip strength reflects overall muscular health. Improving overall muscular health through full body resistance training also tends to improve grip strength. Exercises involving the upper body, such as modified push-ups, resistance band rows, and overhead presses, directly challenge and strengthen the arm and shoulder muscles that contribute to grip. The second component is grip-specific training, which involves directly challenging the hand and forearm muscles. Examples include squeezing a stress ball or therapy putty, which are widely available and inexpensive. Towel ringing, where you hold a rolled towel and twist it in both directions. Finger extensions, where you spread your fingers apart against light resistance, such as a rubber band placed around the fingers. And carrying weighted objects, such as a shopping bag or a bucket of water, by the handle for short distances. Sometimes called farmer's carries. These are genuinely effective exercises for grip strength, and they require essentially no equipment or very inexpensive equipment that anyone can use at home. Now, I want to be honest about something. I am not aware of strong evidence that grip-specific exercises alone produce the same broad health benefits as the associations between overall grip strength and mortality suggest. The associations between grip strength and health outcomes reflect overall physical health and overall physical activity, not the grip itself. So the goal should not be to train your grip in isolation while remaining otherwise sedentary. The goal should be to maintain overall physical health through whole body activity, including resistance training and adequate nutrition, of which maintaining grip strength is one measurable reflection. Think of it this way. A thermometer does not cause your temperature to be normal. It reflects that your body is healthy. Grip strength is similar. It reflects overall health, rather than being the target in itself. Now I want to tell you about grip strength measurement, because this is something that can happen in a clinical setting, and that is becoming more recognized as part of geriatric assessment. Grip strength is measured using a device called a hand dynamometer. This is a simple handheld device that you squeeze and that records the force in kilograms. The measurement takes less than a minute and gives a reproducible, objective number that can be tracked over time. Reference values have been established based on age and sex from large population studies. So a clinician can compare your measurement to what is typical for someone of your age and sex, and identify whether you fall within a typical range or below it. In clinical practice, grip strength measurement is used as part of frailty assessment, sarcopenia assessment, and in some settings, as part of pre-surgical risk evaluation, because grip strength as a marker of overall physical reserve predicts surgical outcomes, including recovery time and complication risk. Now, in primary care settings, formal grip strength measurement is not yet universal, but it is growing, and you can ask about it. If you are interested in having a baseline measurement and tracking it over time, some physical therapists also use dynamometers as part of a comprehensive strength assessment. If you are referred to physical therapy for fall risk or strength concerns, it may be part of that assessment. Now, I want to bring this all together into something practical that you can take away from today. The first thing, understand what grip strength represents. It is not just about your hand. It is a proxy measure of overall muscular health and overall physical reserve, and the research supporting it as a health indicator across multiple outcomes, including mortality, hospitalization, disability, and cognitive health, is extensive and consistent. The second thing, the trajectory matters, not just where you are starting from. Research suggests that improving or maintaining grip strength is associated with better outcomes, even for people starting from a lower baseline, which means it is genuinely worth working on at any age and from any starting point. The third thing, the most effective way to maintain grip strength is to maintain overall muscular health through whole body resistance training 2 to 3 times per week, progressive, consistent, and appropriate to your starting level. This is the same recommendation as for sarcopenia because they are addressing the same underlying issue. Grip-specific exercises like squeezing a therapy ball, towel wringing, or finger extensions can be useful additions, but they work best as part of a broader approach, not as a substitute for whole body activity. The fourth thing, adequate protein intake, as I discussed in the muscle loss video, is the nutritional partner to resistance training. For maintaining muscle mass and strength, including grip strength. The fifth thing, ask your doctor about grip strength measurement as part of a functional assessment if you are concerned about declining strength, or if you have had a formal fall risk assessment or sarcopenia evaluation. Grip strength measurement is a simple, quick, informative addition to that picture. The sixth thing, If you are planning any surgical procedure and you're over 65, it is reasonable to ask your surgeon about prehabilitation, which is the term for building physical fitness before surgery to improve recovery outcomes. Strength training before a planned procedure can improve physical reserve and is an increasingly recognized part of surgical preparation for older adults. Now, let me close with something I want to leave you with. A simple squeeze of the hand that most doctors have never measured in most primary care visits tells a surprisingly rich story about overall health, about physical reserve, about likely future outcomes. The research behind this is decades old and consistently replicated across millions of participants in dozens of countries. It is not surprising information. It is just underused information. And knowing it changes what you should pay attention to. It changes what questions are worth asking at your next appointment. It changes what activities deserve priority. And it changes the way you think about that daily squeeze, not as something trivial, but as a reflection of something that genuinely matters. I am Dr. Chen. Thank you for spending this time with me today. If this gave you a new way of thinking about strength and what it represents after 65, please share this video with someone you care about who is navigating this stage of life alongside you. Leave your questions in the comments. I read every single one, and I will see you in the next video. Take care of yourself.